What happens when a veteran asks for help but instead gets involuntarily committed under the Baker Act?
I'm Katie LaGrone. The VA in Florida is facing serious questions about how its hospitals are using the Baker Act on veterans seeking help. This after a young Marine went to a Florida VA for treatment and ended up being held against his will for days.
Welcome back to the channel, folks. Dr. Sharma here, physician, board-certified psychiatrist, and Air Force veteran. Now, with this episode, I have to give another disclaimer. This is not a forensic analysis of the case. I have not reviewed the medical records. I don't know the intricate details of the veteran's medical history, and this can't be used in court. I'm only reacting to the news reports and the official VA OIG report, which I will link in the description. Also, fair warning in advance, I'll be discussing the topic of self-harm and suicide in detail. If this might be triggering for you, please skip this episode. First, let's start with what the Baker Act actually is. Officially, it's called the Florida Mental Health Act. It was designed to ensure that people experiencing a mental health crisis could get the care that they need while protecting their civil rights. It allows for two main pathways to care: voluntary admission and involuntary admission, or what's commonly referred to as being Baker Acted. Different states have different versions of these with their own specific laws and regulations. Being Baker Acted means someone is placed on a 72-hour hold for evaluation in the hospital. This means that for that 3-day period, the person is in a safe place, they can get treatment, and of course, they shouldn't be able to harm themselves. Now, for this to happen involuntarily, 3 things must be true. First, the person must have a mental illness. Second, they must refuse or be unable to agree to voluntary evaluation. And 3, without treatment, they pose a significant risk of harm to themselves or others. These 3 things have to be documented accurately in the record and thoroughly. The first requirement of a mental illness is pretty straightforward. So they have to have something like depression, bipolar disorder, PTSD, or something similar. They must refuse voluntary admission and evaluation. So basically, they don't agree to sign into the hospital voluntarily. This is crucial in this specific case. Now, if somebody agrees to sign in voluntarily, you have to let them do that. It also says that they may be unable to agree to voluntary admission. So this is like someone who is in a psychotic episode or manic episode, and they're simply unable to make that decision because they're too disorganized, irrational, incapacitated, or something similar. Third, without treatment, so without medication, therapy, stabilization, they may hurt themselves or someone else. Like I said, it's different in different states. In some states, the risk of harm must be imminent, which means the threat of harm to themselves or others is likely to happen soon. It's not that they have a distant history of suicidal ideation, but that it is recent and still actively a risk. Now, this particular case involves a veteran and former U.S. Marine.
By 17, Hunkin enlisted.
While his parents attended graduation ceremonies, 17-year-old Jordan Hunkin could not.
The young recruit even made the local news when he skipped his high school graduation to pursue military service. For the next 8 years, Hunkin, who was part of a special ops radio battalion, would endure multiple tours in Iraq and Afghanistan. By 2012, he left the Marine Corps for civilian contract work.
He was in Florida, where the Baker Act is in effect. And here's what happened. The veteran had initially established care at a VA clinic. He had worked with a few social workers and a psychologist. He was really frustrated at these visits because every time he established with a therapist, they left. He had to keep telling his story over and over again. And then he eventually gets to the psychologist, who's the 3rd therapist he's with. And it turned out that that psychologist was actually scheduled to retire, so it happened again. Fast forward to the wintertime. The veteran came into the clinic unscheduled and he requested an inpatient stay because he was depressed and had recent suicidal thoughts. Remember, he requested an inpatient stay. He seemed rational, he had no hallucinations or delusions. His insight and judgment were documented as being normal. The mental health nurse practitioner discussed a plan for him to be voluntarily admitted to the hospital of his own free will. The veteran then went to the emergency room, but the ER doctor who assessed him placed him on a 72-hour involuntary inpatient Baker Act examination hold for suicidal ideation and depression, so against his will. A resident psychiatrist assessed him, said he was motivated for treatment, discussed the case with an attending psychiatrist, and it was recommended that the veteran be admitted to the hospital. Now, that first ER doctor documented in the progress notes that the patient was to be admitted, and he even said the patient agrees with admission. Admission orders were placed, and then the veteran was transferred to a locked inpatient mental health unit for involuntary admission. Again, even though he was motivated for treatment, he agreed to come into the hospital. For some reason, he was placed on involuntary status. Now on the inpatient unit, when he went to talk to the inpatient psychiatrist, the veteran told him, "Hey, I don't understand why I'm here or why I was Baker acted." He denied current suicidal ideation. He said he'd been struggling with depression for the past year and he had considered suicide, but then he came to the VA for help himself. The veteran was concerned about being admitted involuntarily and how it would seem on his record. This, by the way, does make sense because when you go out of your way to seek care, you don't want to be labeled as non-compliant, rejecting care, and you don't want it to result in more of your rights being taken away, potentially. During the assessment, the inpatient psychiatrist, so on the unit, documented that the veteran was calm, cooperative, and had good eye contact. And then he signed the voluntary admission form, so the involuntary inpatient Baker Act examination hold was gone. But then 2 hours later, the veteran requested to leave the facility. Later that day, a high risk for suicide flag was placed on his chart. He met with a social worker and said he was interested in residential treatment for PTSD. This consult was placed, and then discharge was planned for the following morning. Now, after discharge, the veteran was scheduled for mental health follow-up in the clinic the following week. But once he was out of the hospital, he called and he canceled. He specifically described how frustrated he was with being involuntarily admitted, as if it was against his will. He ended up declining further VA mental health care. The staff at the hospital tried to reach out to him multiple times, but he continued to decline.
Known in Florida as the Baker Act, the state law allows designated professionals to initiate an involuntary mental health exam on someone they deem to be a threat to themselves or others. In Jordan's case, despite voluntarily going to the VA for treatment and even being commended for his courage reaching out for help, he was still involuntarily committed under Florida's Baker Act. The move taking him off guard. At one point, he told staff, "This place is not what I expected, and I don't understand why I'm here," or Baker acted. 2 days later, Jordan was discharged and never went to the VA for help again.
The veteran received no further care from any VA system, and in late summer 2023, the suicide prevention supervisor talked with his father, who confirmed that he died by suicide. The Inspector General's office found that the Baker Act was incorrectly applied. The veteran actually met all the criteria for voluntary admission. Remember what was documented. He was calm, cooperative, rational, normal judgment, normal insight. He was aware of his situation and he wanted to receive care. So why did this happen? According to the report, some staff had a practice of using the Baker Act as a precaution, worrying that patients might change their minds abruptly and leave the unit. But the Baker Act isn't meant to be a tool of convenience. It's actually a legal measure to be used only when criteria are clearly met. It's a backup plan if the patient doesn't agree to be admitted and they're a danger to themselves or others. It's not the first-line option.
He went up the chain, eventually getting the attention of the VA's Office of Inspector General, who investigated. A few months later, the IG released this report that found Jordan was incorrectly Baker acted, his rights violated. There's more. No Baker Act training, no Baker Act oversight, no Baker Act tracking. In fact, the Inspector General's report, which doesn't name Jordan for privacy reasons, suggested what happened to him may have happened to dozens of other veterans seeking help at the same hospital.
Now, why else is this important? Well, in mental illness, we want to make sure that we preserve the patient's dignity and civil rights. If someone is engaged in treatment, we want to work with them on it as a team. We want to partner with them and make decisions together. We don't want it to be an oppositional relationship, right? So when I used to work in the psychiatric emergency room and on the inpatient units, I always wanted to do voluntary admissions with people, right? Of course, you want to partner with the patient, work together. Here in Maryland, involuntary admission is definitely harder to do than voluntary admission for a number of reasons. You have to have these requirements we discussed before, along with imminent risk of harm to self or others. You also need 2 physicians or providers' signatures. So one doctor can't do it unilaterally. It's kind of a check and balance on that process. And then of course you're in this relationship with the patient where you're going against them. Obviously, sometimes this is necessary, right? Like if the mental illness is tricking the person's brain into believing suicide is the only way out, or if someone is psychotic or manic and isn't making rational decisions. But it's not something anyone prefers to do. The other issue is once they get onto the unit, if they're admitted involuntarily, so against their will, you have to try to work with them while waiting for a hearing. At the hearing, there will be a judge, the patient will have a public defender, and you have to argue why the person should be in the hospital involuntarily. It's a lot. And again, you want to avoid this as much as possible. This is also important from a constitutional aspect and civil rights. Involuntarily admitting someone to the hospital is a big deal. You're taking away their autonomy in that moment. So you really have to have a good reason to do that. The reason why it's doable in mental illness is because the mental illness may actively influence the person's decision making and may be clouding their judgment. Remember, if someone comes in with a really high blood pressure, you can't involuntarily admit that person to the hospital for treatment, especially if they're making sense and they want to leave against medical advice. This is why we have to be really careful in mental health. This power is not to be used lightly. At the same time, it is important to be used when necessary. Like I said, sometimes the mental illness can cloud the person's judgment so much that it convinces them that suicide is the only way out. This is irrational, and so in that moment, the person has to be stabilized and treated in the hospital. Remember, there's imminent risk of harm. I also wanted to mention, suicide is really difficult and essentially impossible to predict with any type of reliability. There are risk factors and protective factors, but it's really difficult to predict ahead of time. The consequences of the veteran being inappropriately admitted involuntarily were pretty devastating. The veteran disengaged from VA mental health care completely. He felt betrayed. Despite multiple outreach attempts, he declined further care. And then tragically, months later, the veteran died by suicide. This case is a heartbreaking reminder of how critical it is to follow procedures correctly, especially when trust and mental health are on the line. Now, importantly, I'm not saying that was the reason for his suicide or the only reason. We don't know. However, he was engaging in care fully before this incident, and then his engagement changed drastically after the fact. If he had continued to engage in treatment and care, the outcome might have been really different. Again, none of us can say for sure, but it is a possibility.
The IG's report falls short of blaming the hospital for his death, but it acknowledged his experience likely contributed to him feeling, quote, misled by the VA.
Now, there are a few key takeaways here when it comes to the practice of psychiatry and mental health. The first is procedural training. The staff involved lacked adequate training on the Baker Act. Annual training was required, but it wasn't provided. It is crucial that this type of involuntary admission be trained extensively. It's a huge deal. I can't understate this. Again, we're taking away someone's rights in that moment, so we have to know what we are doing and why. 2, trust matters. The relationship between patients and mental health professionals is built on trust. Misusing laws like the Baker Act can shatter that trust. This is front and center in this case above all else. After this incident, the veteran's engagement in the VA system changed dramatically, and it might have also impacted other veterans and their decisions on whether or not to seek help within the VA medical system. 3, accountability. This case highlights the need for clear oversight and proper documentation. Healthcare providers have to work within legal frameworks and prioritize patient autonomy whenever they can. And I mean all providers, not just mental health providers. Remember, the emergency medicine doctor was the one who initially did the involuntary admission for that veteran.
I want them to work to help bring these men and women the help they need. He was in the radio battalion. They were ambushed.
Jordan's family just wants change and a promise their son's death off the battlefield is taken as seriously as it would be had Jordan died on the battlefield.
As a psychiatrist, I can't stress enough how much these moments matter. When someone reaches out for help, it's a huge step, especially for veterans who may already be really hesitant to do so. Every decision we make as providers has lasting impacts, not just on treatment, but on a patient's life. Now, I know that we got technical, but this story isn't just about policies or procedures. It's about the real people affected by them. I'd love to hear your thoughts in the comments. Do you think there should be better oversight of the Baker Act? How can we rebuild trust in the mental health care systems, especially within the VA? Has the VA lost your trust either because of this or things in the past when it comes to the Baker Act and talking about suicidal ideation? Let us know in the comments. That's it for today's video. I hope this was helpful for you guys to take a deeper look at how this misuse of the Baker Act resulted in a significant loss of trust for the veteran. If you found this helpful, please like, comment, and subscribe to my channel. It really helps, and it tells me that I'm doing something right. Also, please drop a comment below about your thoughts on the topic, and if you have requests on what to cover in the future, I'd be happy to make a video on it. As always, thanks for watching. Dr. Sharma signing off. See you next time.